Okay, ma'am.
Right. So if you've read and understood considering its surgical pathology station, please tell me what would be your provisional diagnosis.
This may be a case of a benign parotid tumor, maybe the pleomorphic adenoma.
Okay. All right. Right. Okay. What is pleomorphic? How
It's
would you?
the remarkable histological diversity, and
Yes.
it's a benign tumor having the mixed ductal epithelial and myoepithelial cells and showing the epithelial and mesenchymal differentiation.
Okay. What is adenoma?
Adenoma is the tumor of the glandular cell.
Okay. Yes. Considering, all right. Okay. What other differential diagnosis would you consider?
Okay, ma'am. It's maybe the parotid gland carcinoma,
Yes.
preauricular lymph node, or lymphoma.
Okay. What is the most, all right, most commonly occurring swelling or mass present in the parotid region?
Most probably is the pleomorphic adenoma.
Okay. How would you rule out if there are any clinical signs of malignancy present
Okay, ma'am.
on this?
If the growth rapidly increase in size, the
Yes.
facial nerve is involved,
Yes.
and the involvement of the overlying skin and the underlying structure
Yes.
and the hard consistency.
Yes, and there'll be invasion of the
Lymph node.
overlying skin as well. Yes. Okay, what are the different types of parotid tumors? How would you classify
Okay, ma'am. It's
them?
benign 85% and
Yes.
malignant 15%. Benign
Good.
includes the pleomorphic adenoma, Barthel's tumor,
Yes.
oncocytoma,
Yes.
cyst adenoma, basal
Yes.
cell adenoma, canelocular adenoma, and duct papilloma. And malignancy includes the mucoepidermal carcinoma, acinic cell carcinoma, adenoid cystic carcinoma, adenocarcinoma, and squamous cell carcinoma, and mixed malignant tumor.
Good. Okay, what is the most common or most acceptable investigations to be carried out in outdoor department?
Okay, ma'am, I can do the ultrasonogram of the
Very good.
swelling as well as the FNSC,
Fine
fine needle
needle,
aspiration
fine needle
cytology.
cytology. Yes, very good. What would be the features of malignant cells?
Okay, in histological, we'll get the loss of normal tissue architecture, pleomorphism, hyperchromatic nucleoli, high nuclear cytoplasmic ratio, loss of differentiation, hemorrhage, and necrosis.
All right, please tell me what are the differences between cytology and histology?
Okay, ma'am, cytology is the study of cellular architecture and function, and histology is the study of tissue under microscope.
Okay, good. Is there any test which can be done intraoperatively which
Yes,
helps
ma'am.
you to rule out if the lesion is malignant?
Yes, ma'am. In clinically perioperative, if the swelling is the heart, involvement of the facial nerve or
Mhm.
surrounding structure, and the investigation is the frozen section biopsy.
Very good. Okay. Once you have done and taken the biopsy and the lab comes out and you get to know that they are lymphocytes and the Langerhans giant cells, how would you interpret this
Okay,
lab
ma'am.
report?
Okay, if I get the Langerhans giant cell lymphocytes, this may be a case of tuberculosis.
And it could even be a granuloma.
Yes, maybe granuloma.
Yes, all right. On the contrary, you've taken the fine needle aspiration cytology, and the lab result shows that the lesion contains epithelioid cells with brown cytoplasm. Then what
Yes,
would be your interpretation?
it may be the malignant melanoma.
Melanoma. Very good. Please define the term high sensitivity test.
Okay, ma'am. High sensitivity includes the identify confirm identify those with the disease. That means the true positive.
Okay. And how would you define high specificity? Specificity test.
Identify correctly those without disease. That means the true negative.
All right. Please help me and read this image.
Okay, ma'am. This is the hematoxin and eosin stain under microscope, having
Very good.
shows the ductal epithelial cell, myoepithelial cell, adipocytes.
Yes, very good. These are the
Ductal epithelial cell,
very good. And what are these? Vacuoles.
adipocytes.
Very good. And what are these?
It's it's this acinic cell.
Okay, you could say so. Right. Now tell me. Right. If once you are doing in the outdoor patients, you're taking the fine needle aspiration of a patient, and your assistant accidentally gets a needle injury. What would you do next?
Okay, ma'am. I will allow the assistant to running the bloods and of his hands and wash with soap.
Yes.
Then I will assess the incidence, then assess the patient by taking history and sample under his by his consent. Then I'll record the incidents. I will speak with the occupational health worker, then documentation.
Okay. Right. How would you describe the appearance of pleomorphic adenoma?
Okay, ma'am, it's a benign tumor
Yes, and
mixed
more.
with the ductal epithelium and the
Yes.
myoepithelial cell, showing the epithelial and mesenchymal differentiation.
Yes. And what are the three components that are present here?
It's the epithelial, ductal epithelial, myoepithelial cell, stromal cell, and mesenchymal cell.
Very good. Okay. What is the prognosis of a patient who presents with pleomorphic adenoma? Five years survival rate or prognosis?
It's maybe good, ma'am. It's a benign
Considered,
tumor.
yes, it's considered to be good. All right. Okay. What are the risk factors that contribute to the formation of pleomorphic adenoma?
If the patient having the autoimmune disease, diabetes, mumps, um, gout,
Okay. And
and alcoholic patient,
yes, and smokers.
alcoholic patient, smoker.
Smokers.
Uh,
Good. Thank you. Please, if you could help me to read these two images.
okay, ma'am. It's the MRI of the brain showing the
Hyper.
hypointense lesion in the left
Yes.
parotid region.
Yes.
Uh, Maybe the benign parotid swelling, maybe the
Yes.
pleomorphic adenoma, because the
Yes.
lesion is rounded and the
Mhm.
circular outside.
Yes. Rounded and well defined.
All yes, all defined, all
Yes.
defined.
Because there is no innervation. There's no, yes, it's well defined. There's no
Yes,
irregular margins.
margin regular.
Yes. Good. Thank you.
Thank you, ma'am.